subject concept and you talk about his interest in history.
And can I introduce, well, your host for this part of the evening, David Burrows, MP. Thank you.
Thank you very much. It's a great pleasure to welcome you to the other place. That's how we describe this place, which you'll notice if you haven't been here before that it's, if you look down, you'll see it's red in colour. That helps simple politicians like myself who are in the other place, which is the House of Commons, which is all green, to know I'm in the wrong place. But we're all very much in the right place today, which is very much an event to celebrate, actually, as well as to really look at how we can further progress the relationship between Turkish-speaking health professionals in the United Kingdom and in Turkey. What is very good about this event, for those who were at the conference earlier today in Committee Room 12 will know I've already said this, is that this is not the first event. And it's excellent that we've not just had one, but I was reminded that my maths wasn't very good. I thought it was 3, we've had 5. This is our 5th event, and that's really important, because it's important not just to have one-off events, but to have a progression of events that really help to define and shape the growing relationship between this country and Turkey. It's excellent to have the ambassador here today, who I will formally introduce shortly, because there's a lot happening in the world at the moment. There's a lot happening that's engaging the United Kingdom, the European Union and Turkey, quite rightly so, when one's dealing with profound challenges around Syria and that region. And I said in the House, as others, we do very much, we should give credit and support to Turkey in relation to the huge burden that they've had to take in relation to the refugee migrant crisis. And so it's particularly a privilege that you've been able to have the time to be with us when there's other discussions happening. But it's also important to recognise the relationships between this country and Turkey are defined in other ways as well, but ones that are actually connected with the crisis that's facing Europe and the Middle East. And that is in relation to health. And that's why it is so good that we have had this event today, because it's looking at the ongoing relationship between Turkey and the United Kingdom in relation to health issues, but also recognising, as health does, which is highly relevant and appropriate to what is happening day in, day out. And so we've had in this conference today, as has happened in previous years, and it's work that doesn't just happen at conferences. ITSEB is involved in many seminars, in many meetings, in visits as well. But those involved a number of topics. So today we've heard topics ranging from plastic surgery to IVF to breast cancer to coping with issues around the Syria refugee crisis, hearing about visits, whether it's to Calais, as I recently undertook with ITSEB, and also what's happening in relation to the Syrian crisis and refugee accommodation in places around Malatya and elsewhere. As well as hearing from Turkey around the issue of health reforms and having an open dialogue. And that is so important to see the breadth of issues that ITSEB gets involved in, and also the depth, because what's impressed me over the years, and impressed other members of Parliament who came today in previous years, is the expertise that's emanating not least from Turkey, and how we have as much to give but also to take. And very much in terms of the expertise that is coming. And so that is welcome, but also welcome for us in Europe to also recognise as much as elsewhere about the role that we have to take in relation to dealing with issues of refugees. So it's really welcome, this event today, and it's really important for us to thank, first of all, and I'll ask us all to do, to thank ITSEB and Dr. Ali Demirbag and his team for all the hard work they've put in over the year, which culminates in today's event. So we have a loud round of applause to ITSEB and to Dr. Ali Demirbag. But it's my pleasure to introduce the Ambassador to Turkey, His Excellency Abdurrahman Bilgic, to address the conference. Ambassador.
distinguished members of both houses. I know Lord Bath will be joining us very soon. Dear health professionals and guests. It is a distinct pleasure to speak at the British Parliament on the occasion of the Medicine Day. We gather this evening to celebrate this joyful day of our health professionals. During the weekend, we were in Bath, bringing together almost all politicians, businessmen, ministers, and journalists, both from Turkey and UK. Now I'm here. This afternoon, I know that fruitful discussions were had on various topics such as career awareness, gambling, drug addiction, and well-being at the 4th Medicine Day seminar here in the Parliament with the participation of health professionals from Turkey. I thank our hosts, Member of Parliament Mr. David Barrows and Lord Bath, along with Mr. Ali Demirbağ, Chairman of the Association of the Turkish-Speaking Health Professionals, for organizing the seminar and the reception. Distinguished health professionals, helping all human beings, regardless of their nationality, religion, or race, at all times, stands at the heart of your profession. Whether those in need are fleeing from conflicts or persecution or suffering from natural disasters, you are always there, responding swiftly and doing everything in your power to ensure their health and well-being. You sometimes risk your own lives to save those of others. It is, in fact, a common moral obligation and an international responsibility for all of us to help others. But this mission cannot be accomplished without your knowledge, skills, and expertise. Dear guests, today's seminar also touched upon the health-related issues faced in the Syrian refugee camps. Mr. Barrows and Mr. Demirbağ recently visited Calais and observed the living conditions of the refugees. It's true that health professionals have been exerting tremendous efforts to relieve the suffering of Syrian refugees wherever they may be. Let me share some numbers and thoughts about Syrian refugees in Turkey. Hosting more than 2.7 million Syrians, Turkey is now the largest refugee hosting country in the world. The number of the Syrian babies born in Turkey has exceeded 151,000. At 26 temporary protection centers, 272,000 Syrians are provided with not only food and shelter, but also health and education services, psychological support, vocational training, and social activities. In addition, around 2.5 million Syrians who live outside those centers also benefit from free education and medical services. Around 11 million health services have been provided, and more than 316,000 Syrians have been operated in Turkey. Until now, Turkey has spent around $10 billion for Syrians that have crossed the border in Turkey. I wish to take this opportunity to mention that the first ever World Humanitarian Summit will be held in Istanbul from 23 to 24 May this year. I hope that this summit will provide an historic and much needed occasion for further discussions in this regard. Dear friends, I would like to conclude by thanking the Association of Turkish-Speaking Health Professionals and its members. This association helps Turkish-speaking patients in the UK to ensure that they have better access to the healthcare services and that they benefit from it efficiently. Moreover, the association strengthens the cooperation between Turkey and the UK in the health sector in general. That's why I commend ITSEB for its activities and contributions to the benefit of the Turkish-speaking community in the UK. Once again, I congratulate all doctors and health professionals on their Medicine Day. Thank you.
Ambassador. Lord Balfe kindly has hosted us for this part of the evening because it has to be a Lord that does do that. He's had to go away because he's very much involved in the trade union bill. In fact, he has an amendment which shortly will be considered. So he's apologised that he would normally be formally introducing and welcoming you here, but he will come back. He's assured me he'll come back, and you know, politicians' promise, as you know, is very good. You laugh. He'll be back, and so we look forward to hearing from him later. But I look forward now very much to welcoming.
I think I would like to say a few
Would you like to say a
words.
few words? Absolutely, absolutely. I'm over this. Look at yourself, please.
Thank you.
Please do.
Hi everyone, my name is Pınar Demir and I'm one of the committee members of ITSEB. I want to thank you, Your Excellencies, Lords, Ladies, distinguished guests, and last but not least, ladies and gentlemen, for joining us today on this important day. And this has become our way of celebrating Medicine Day once again here in the House of Parliament. Before I introduce the program of speakers, I would like to say thanks to Lord Balfe and David for hosting this event. We had actually proposed to have live music today, but due to what happened in Turkey, in Ankara, the terrorist attack in Ankara, we decided that we will cancel it. So our heartfelt condolences goes to all those who have lost their loved ones and who have suffered as a result of this terrorist attack. I don't think there's anyone here who hasn't heard of ITSEB before, but in case there is anyone who hasn't heard of it, I will say a few words. ITSEB was founded in 2011 and its mission was to bring together Turkish-speaking healthcare professionals of UK and Turkey. I'm glad to say that the organization has grown over this time to make significant contribution to the healthcare provision of both countries, and it has become an important bridge. ITSEB supports and will continue to support all Turkish-speaking healthcare professions in the UK. And I want to say that we have made a significant contribution to our community and to access to healthcare services. So without further ado, I will pass you to David to invite, I think, Dr. Demirberg. Thank you.
Yes, because we're a pleasure to be able to invite Dr. Demirberg to come as the chair of ITSEB to come and say a few words. And we will know Ali in many ways. He's a friend as well as being a health professional and chair of ITSEB. And he showed us something of him, and I think what is the characteristic of ITSEB, which is so engaging and infectious. When he initiated the visit to Calais and Dunkirk, it's good to see Churchill from Even Standard and others who joined us on that visit. And that was organised, something I'd wanted to do, but it was on the initiative of ITSEB and Dr. Demirberg. And that was very much around just a spirit of humanity and concern, which motivates people to be in the profession of health, which is a calling conviction to be concerned for others. And that was that same passion and concern which led us to have that visit to Calais and Dunkirk. And see, sadly, what really we saw examples where there wasn't that same concern and level of compassion, which was extraordinary just on our doorstep, our European doorstep. That was happening and having to be reliant on volunteers and Médecins Sans Frontières to plug the gap that had been left by authorities and others. And that enabled me to inform me to be able to be involved in that issue in debates in Parliament and further work. But that just as a little example of Dr. Demirberg's initiative and involvement, and how ITSEB's the ripples go far and wide and go beyond just simply the event here and do have an impact, whether it's in Parliament in terms of debate or in medical practice and development as well. So I want to very much thank and welcome Dr. Demirberg to the stage now.
Of course, I'm a little nervous after such a fantastic representation. His Excellency, Consul General, Mr. David Burrows, dear my colleagues, my friends, community members, it is very important to see in Medicine Day in part of the ITSEB. There are many things to say. Today we have a fantastic event in terms of the subject, our guests. They take their time. They came from Cyprus, from Turkey, go through all the important issues like refugee subjects, also some plastic surgery issues, war, surgery in war, breast cancer study. Those subjects are very important for the community. But most important thing is, as an individual, every one of you have been a part of our program. Whenever we say it's having one organization, you kindly join us. You would like to contribute us, and you would like to put some of the effort you would like to be. Of course, those we have three very important objectives. One of them is helping our patients. Secondly, our health professionals, and also try to become a bridge between two countries. Why we are become a bridge between two countries? Am I feeling because I'm having a speech too hot, or is it?
It is.
It is too hot. Okay.
It's not personal.
So I was a little bit anxious. Is it because I'm so nervous? I'm getting hot and started sweating. But I'm used to having public speech. But I'm not the greatest one. So accepting that part. What I would like to say, especially David Burrows, helping us be part of the ITSEB, advising, guiding us, and we have a lot of discussion. But most importantly, we have values. We are looking for best of human being interest. We have a number of objectives, and we would like to achieve. I knew without you, we are not able to go that far. So, if we are going to work together, I'm sure we will be helping more people, and we can change the perception. Why it is important changing perception is one sentence. When I was in Malatya, talking with the 10-year-old boy who lost his leg, and he asked me when he's going to get his leg grown. So when we are talking about massive projects like crisis, politics, Syrian, Assad and other countries, it doesn't work like that. It doesn't work one child leg. That's why we need to work on it. We need to pass those messages to everyone who is fighting for almost no reason. That's why I would like to ask you, being with us, supporting and working with ITSEB, and I would like to thank every one of you again being here and in this occasion. I would like to give you small information about that chair. Whoever sits there, you don't have to pay, but if you take a picture, the company is going to donate to Great Ormond Street Hospital, which we are working with them, and I think there are some Great Ormond Street Hospital representatives here. There you go, they are great. Last 2 years we are working with them. Please make it sure you sit on that chair and you take your picture, and the company is going to donate with the number to the Great Ormond Street Hospital. Thank you very much.
they were very much our recipient charity last time. It's excellent. If you don't know about, well, let's hear now. From expertise, real world-leading expertise, which the NHS can be proud of, but also very much reliant upon the generosity of donors and people here. So over to you, Mel.
Thank you. Thank you very much, and thank you so much for inviting us here today. I'm joined by my fellow ambassador, Faiza Yazin, who is a very passionate ambassador because she was treated and cared for at the hospital. Excuse me. So I just wanted to thank you all very much for supporting the hospital, for ITSEB for supporting the charity. It means so much to us all. We're doing some great work in some of the cutting-edge treatments that and caring for children at the hospital. We care for about 250,000 children every year, so you know it's a big enterprise, and we're very much reliant on charitable donations to really develop the research that we're doing at the hospital. So I just really wanted to say thank you very much, and just to say also how proud we are of the links we have with Turkey. I know most of you here have a connection of some sort with Turkey, and we treat children from Turkey, we care for children from Turkey, which we're very proud of.
And just interrupt, thank you. There is a division in the Lords. If we have any Lords in here, there is a division in the Lords. Sorry, thank you.
Any Lords here? So yeah, we're very proud of our relationship with Turkey, and we not only do we care for children from Turkey, but we also have some research collaborations with hospitals across Turkey, actually, in Ankara, in Istanbul, and in Izmir, and that's all related to understanding the basis of kidney disease and finding new treatments for treating children with kidney disease, which obviously is very serious. So thank you so much. It does mean a lot to us. The money that ITSEB has so generously raised, and hopefully you will all do so by sitting on the chair. Will be used to not only to function to help with the research that we do there. We spend about £12 million a year on research, which the charity supports, but it will also be used for things like providing accommodation for mums and dads who, so they can stay with their children while they're in hospital, help us develop the infrastructure of the hospital. So we are so very, very grateful. Thank you for inviting us here today, and if anyone would like to talk to us about the work that GOSH does and our connection with it, so we'd be delighted to be with you. We'll be here all evening. Thank you very much.
Very good, thank you so much. So do make sure you sit.
Who's going to take the picture?
Pictures will be taken.
There will be enough people, don't worry.
And so do make use of that. But also just make use of networking, and part of ITSEB is networking. Meet someone you haven't met before. That's my challenge to you. And also obviously to make use of this fantastic location. It's excellent to be here. We will get to Lord Bell eventually. He's in the middle of a vote. The way it works, so the division bell is gone, and you see there's a red bell going, and it's a division bell in the Lords. So they've got a vote and I haven't. They get 10 minutes to go into the division lobby, which is the corridor just to the side of the chamber. They get 10 minutes to go in there, then the door's shut. They have to get in there in 10 minutes. In the House of Commons we get 8 minutes. I think we're supposed to be a little fitter, that we get there quicker before our doors shut. They've got 10 minutes, so they'll have the votes, and I think Lord Bell may well have another amendment that he's got down as well about the trade union bill, and then he'll join us as well. If you want to, particularly if you haven't been before, if you want to be shown round the House of Commons, which we finished early today, everyone's gone off having heard the budget to different places, but if you want to come into the House of Commons and hopefully for the House of Lords stop talking about the trade union bill, you'll have a chance to go into the House of Lords. Then towards the end of proceedings, about sort of 9:30, there'll be an opportunity to have a tour with me, and you're very welcome to join me on that. And so I can tell you a few stories about what happens in the House of Parliament. But for the moment, that's it. As far as formal speech is concerned, please do stay and enjoy. And if you can brave the weather outside, I don't think it's raining, so it's a beautiful view as well across the Thames. And enjoy the House of Parliament. And thank you so much. It's all you do, and thank you and congratulations and celebrate Medicine Day. Thank you. Please do.